One of the things that's putting enormous pressure on the NHS is that not just more people are living longer and therefore getting ill, but the fact is that the older we get, the more conditions we have that need medical management or attention. And it's the conflicts really of trying to manage different illnesses in people who have got several illnesses going that cause a real challenge. And the way in which modelling can help us with that is to understand, first of all, what we should be doing for each of the pathways that describe an individual illness, and then trying to work out what the trade-offs are in terms of helping people to make the best overall lifestyle out of the conditions that they have and the treatments that they need to have.
I think the primary problem behind the data being collected for long-term conditions is that it is a very fragmented process that we follow currently within healthcare. So the patient data does not follow the patient. People with long-term conditions are primarily seen by primary, secondary, tertiary healthcare professionals. The data isn't shared between them, so there's a lot of data loss. Patients have to repeat things that have happened to them, medications that have been prescribed, conditions and symptoms that they have had, leading not just to data being repeated but also being lost. The sort of solutions that we are looking at to improve the quality of data is to have structured data models underlying our applications. So we use healthcare standards that have gone through all the processes for vetting them as good standards for electronic patient records.
One of the more surprising and actually particularly unexpected observations that we've seen within this particular study on alcohol-related brain damage in this younger population is actually very extensive changes to the central nervous system, and that's not been observed before. And the only way we've managed to gain that insight is by a modelling approach which is integrative and monopolises on, you know, almost a whole systems approach to understanding the individual. And interestingly, what that does do is it lays also the possibility and the foundation to give insights into other pathologies as well.
More and more people are living longer and getting Alzheimer's, and it's, among other things, it can be very expensive. It can require a lot of hospitalisation, and it's very distressing for the families. So the kind of uses we have for technology there would be reminder systems where they can be based on smartphones again. One type of reminder system we've looked at is video reminders, where the carers can record messages or send them live, and it appears as a little video on the phone with the video or a live, like a TV, with the daughter saying, you know, don't forget to take your pills, Mum, it's nearly time. We're particularly interested in being able to model and predict whether or not the patient will adopt the technology successfully. So if you give an Alzheimer's patient something that's meant to be a solution to all their problems and it's going to help them, you know, manage in the home and so on, and they can't really use it and they can't come to terms with it, obviously that's very upsetting for them and the families. But conversely, if they could benefit from this technology, it may just keep them an extra 6 months at home, but 6 months is a lot for some of these people.